Johnson & Johnson and 3 of its subsidiaries have agreed to pay more than $2.2 billion to resolve criminal as well as civil claims that they marketed prescription drugs for uses that were never approved as safe and effective. And that they paid kickbacks to both physicians and pharmacies for prescribing and promoting these drugs. It creates financial incentives to increase the use of certain drugs, potentially putting the health of some patients at risk. Now, every time pharmaceutical companies engage in this type of conduct, they corrupt medical decisions by healthcare providers. They jeopardize the public health, and they take money out of taxpayers' pockets. These are not victimless crimes. Americans trust that the medications prescribed for their parents and for their grandparents, for their children, and for themselves are selected because they are in the patient's best interest. Laws enacted by Congress and the enforcement efforts of the Food and Drug Administration provide important safeguards to ensure that the drugs are approved for uses that have been demonstrated as safe as well as effective. Efforts by drug companies to introduce their drugs into interstate commerce for unapproved uses subvert those laws. Likewise, the payment of kickbacks undermines the independent medical judgment of healthcare providers.